And of course, we're definitely talking about vaccinations this morning in light of what we heard from the industrial court from its president Deborah Thomas Felix on Friday. And we just spoke to a labor law consultant, Dr. Jamil Broom, who's saying that he believes that there should be mandatory vaccinations in some workplaces because he says the public health regulations are just not enough in some instances where you can properly social distance. Well, let's welcome Education and Research Officer of the OWTU, Ozzie Warwick, to get the union's perspective on what Thomas Felix has said, what's happening in the workplace, and even what we heard from Dr. Broom. Good morning to you, Ozzie.
Good morning to you, Natalee, and good morning, Trinidad and Tobago. It's nice to have a chat with you again. It's been a while. Yes, so I do look forward to our little interaction here this morning.
Well, you know, we always have a sprightly one, so let's get right into it. Your interpretation of what Deborah Thomas Felix has shared with us at the opening of the industrial court, the reopening.
Okay, as I do that, I want to, Natalee, give the context in which she said what she said. And she made a very fundamental point before getting into the specifics, which is that even in a crisis, international labor standards do not go out of the door. It's like, for example, if you have, whether it's a public health crisis, it's a natural crisis, whatever it is, the rule of law, international labor standards, those things don't disappear. And I think once she said that context, she then went into why mandatory vaccination, or rather the imposition of mandatory vaccine policies in the workplace is indeed the unilateral changing of your terms and conditions, and that is illegal simply because international labor standards still exist, principles and practice of good industrial relations, that still exists, the rule of law, that still exists. Those things didn't disappear with COVID, and as a result of that, she is saying that, listen, you cannot, as an employer, simply pronounce and unilaterally change the terms and conditions of your employment. I mean, the employers, they have to make it make sense. You cannot just simply come one morning and say, give an instructions. I heard the good doctor earlier, the labor consultant, and he was talking about that you can give an instruction. Giving an instructions is very different to actually changing your terms and conditions of work. And that is the point that the president of the industrial court is making, that once you understand and once you agree that international labor standards, international human rights law, the rule of law do not fly out of the window even in an instance of a public health crisis, then you have to follow what are the practice and principles of good industrial relations. And that is the point she's making. And I have to tell you, Natalee, that the entire trade union movement, all three federations, completely endorse that point, because this is what we have also been stating, that whilst we do not have an issue with vaccination, let's just get that clear. That's not the issue. The issue is whether an employer can come from one day to the next to simply change unilaterally, yeah? But she was very careful, unilaterally change your terms and conditions. And so why it is important for her to
So it's not that it cannot be changed. As you said, I think she really stressed on the fact that it cannot be a unilateral decision, that there has to be consultation and that there has to be dialogue. Now, let's get to that scenario. What if the employee and the employer sit down and say, okay, listen, the employer explains that this is why we're trying to get the workers vaccinated for point A, B, C, D, and E. The employee might say, well, you know, F, G, H, I, J, K, L, you know, and at the end of the day, they don't agree. And that's one of the points that Dr. Broom raised. He says that consultation does not necessarily mean agreement. Is that the employer has the responsibility to explain and to educate and to inform why he or she is taking this route. So if it gets to that and the employer decides that, okay, I've explained everything to you, I've explained to you why this is, you know, why it's important for the workplace to keep it safe. Under those circumstances, would the union support, just in that instance, because I think this is something we'll have to deal with case by case, will the union support vaccination in that particular workplace?
I have to tell you that the relationship has to be equal, meaning it is not simply that the employer comes and say, we are implementing this. The idea behind the process of consultation is also taking the views of the workers. So the workers would also have recommendations and would have suggestions. So it's not only a question of whether the workers will reject what the employer is saying, but it's vice versa. And I can tell you, Natalee, in the cases where there are recognized majority unions involved, the unions have come up with proposals to say, listen, we believe that in order for you to meet the criteria of Section 6 of the OSH, which speaks to minimum criteria, we would like to see the following protocols implemented. Because remember, Natalee, the vaccine don't stop the spread. And one of the mistakes you don't want to make is to suggest that with vaccines, you start a lapse on the other prevention methods of sanitation, etc. So the point is that a consultation process also involves the employer taking on board the suggestions, the reasonable and practicable suggestions of the employees or the trade union. And if it goes to court, that is what the court is going to weigh, not whether you had a discussion, because you could have a consultation and I say, Natalee, I want you to do X. And Natalee say, well, I don't want to do X. And then I will say, well, I had a consultation with Natalee and she doesn't want to do X. No, the court would look at, you suggested X, Natalee suggested Y, and the court will weigh which is more reasonable and or practicable to determine whether that consultation was genuine. So I think it is important to appreciate that there's a value in hearing the suggestions and recommendations coming from workers and from the trade unions, who put together, in terms of the trade unions proposal, the idea of doing risk assessment, having a risk assessment approach, case by case, site specific. I mean, and that came from the trade unions, so that an employer don't simply go and push it down the throats of the workers, but can say, okay, let us seriously assess the risk involved in your specific task at this specific location. The other thing, Natalee, before we wrap up, I think is so important that is causing a lot of problems across the board. And it has to do with this campaign of vaccinate to operate. You see, what that did, Natalee, it took out the public health element, it took out the health aspect. It is all about you getting vaccinated so you could go to work, or vaccinate to educate. You're getting vaccinated so you can just go to school. But it has nothing to do with your health. Once you do that in public health, that is a big no-no. And that created a lot of confusion, a lot of suspicion by a lot of people. And as a result, that campaign in itself created the vaccine hesitancy. It has to be persons are being told that, listen, you vaccinate because you want to give yourself and your family and your body a fighting chance. That should have been the message, not vaccinate to operate. I mean, make it make sense, Natalee. It's right. Crazy how that campaign unfolded.
Because, Professor Ruddock sent me a message just now on Instagram, and she was saying that she wished that in the first interview, I would have dealt with those workers who are vaccinated. So from the union's perspective, if the union is representing those workers as well, how do you defend their right to stay protected, even against the co-workers who don't want to get vaccinated?
Right. Now, as a trade union, we have to represent all our members, those who are vaccinated and those who are not vaccinated. And one of the things that we have always maintained is that we need an approach that is education and persuasion, not threats and not bullying. The trade union has an opportunity to talk to its membership in terms of those who are vaccinated and those who are not vaccinated. And therefore, how can we come up with protocols within the workplace that will protect both vaccinated and unvaccinated, those who choose not to be vaccinated? But one of the things that we've recognized in practical terms, Natalee, when you take that approach, a sort of respectful approach, you would find that many of the unvaccinated workers eventually come along and become vaccinated because they feel that, listen, I really want to protect myself and my family. So it's no longer about terms and conditions of work, which raises a lot of suspicion or this feeling that I'm being forced or threatened, but rather I seriously consider, listen, what is important to the well-being of my family and myself, and therefore I would decide to get vaccinated. But the trade unions will represent both those who are vaccinated and unvaccinated. What we are suggesting is that what is required is greater dialogue at the shop floor level amongst workers and between the workers and the employers.
I know the trade union will represent both, but what I'm asking is for those, if you have a workplace where, let's say 55% of the people are vaccinated and they're saying, listen, we need you to protect us because at the end of the day, these people who are unvaccinated are posing a risk to our health. How does the trade union protect those people who are vaccinated? Because I think over the months, we keep looking at those who are unvaccinated and, you know, what legal course or what redress they have. What's the redress for those who are vaccinated and are seeking the same kind of protection?
Well, we recognize that the protection has to be across the board. And what we are recommending is additional protocols be put in place in a workspace or in a shop floor where there are some who are unvaccinated. In other words, I am telling my members who are vaccinated, here's what we are going to do. We are going to suggest to the employer that they put in place protocols, which is additional protection in terms of those who are unvaccinated. For example, you have those instances where we talk about double masking or a mask and a shield. We are talking about those who are unvaccinated. The employer will ensure that they are tested on a regular basis, etc. In other words, we would suggest and recommend to the employer to put in place protocols that will protect those who are vaccinated, but those protocols will also protect those who are unvaccinated. And that is our approach. We do not like this duality of vaccinated versus unvaccinated. It is vaccinated and unvaccinated, and together they have to work, and therefore we have to put in place protocols that protect the both.
Have we had any cases? I know that Deborah Thomas Felix indicated to us that over 178 COVID-related matters have been filed in the industrial court. Have we had a resolution to any of them as yet, as far as the union is aware?
No, we have not had a resolution to any of those as yet. And let me just say, as we wrap up, yes, the country is facing a crisis. The Caribbean is facing a crisis, and we are fragile economies, we are fragile countries. But I think the right approach in a crisis such as this is for us to bring to bear the fundamental principles of social dialogue. That is what is critical. That is what is needed. And you see that being implemented, for example, in Jamaica, in Barbados, where there's a recognition that, listen, the Caribbean people don't really trust their governments. So you need a wider range of stakeholders being involved in the campaign in order for the workers and in order for the population to see a really united campaign around making sure that they are healthy and making sure that they are safe. That is a more fundamental approach.
As you say that, has there been any correspondence between this government and the union to see if it can work together to have that kind of a stakeholder agreement on the way forward?
There has been no correspondence, and it is as a result of that lack of commitment to that process. You would have seen that the trade union movement and the employers had to reach out to each other to try to carve a way forward. So there was a successful meeting with the Employers Consultative Association, as well as meetings with the Joint Chambers of Commerce. But what that tells the population is that both trade unions and employers are trying to carve a resolution that will not be one that violates the principles and practices of good industrial relations, and more importantly, can bring out a safe workplace. And that is critical.
And what of the point that Dr. Brew made, that there are certain environments where the public health measures are just not enough, where you can protect workers, properly from the COVID-19. So he believes that there should be mandatory vaccinations in some in some workstations, in some organizations. What does the union make of that? Is that something the union would support any at all? Understanding that, yes, there are places where you can't social distance, like as you said, in the hospitals with nurses, it's impossible. You have to be sharing space. You have to be moving from point to point. You have to be interacting right across the board.
I was surprised that the goodly doctor did not refer to risk assessment, because the union's proposal is that we take it as we take a risk assessment approach. So if you implement a risk assessment in your workspace at the shop floor level or within a particular site, whether it's a hospital, a nursing home, a factory, etc., or a retail outlet, once you go through the process of a risk assessment, there is no reason at the end of that risk assessment, because that is done scientifically, to end with a determination that indeed certain workers should be vaccinated. And I really don't see workers opposing that at all once they feel that they were part of the process and therefore part of the decision.
And the union would support it under those circumstances that you outlined?
Yes, the union supports a risk assessment approach, case by case, site by site.
All right, Ozzie, we have to leave it there, but thank you so much for speaking with us this morning. And let's hope we can really get that collaborative effort so that we can determine the best way forward. And if that is vaccine, that we're all on board.
Thank you very much for having me, Natalee. And I hope Trinidad and Tobago continues to stay safe and that we can come out of this, but we have to do it together.
Yes. Ozzie Warwick, their Education and Research Officer for OWTU, speaking.